My CLL story is a long one. It started 14 years ago, and I'm an early adapter. I jumped onto the first trial of a drug called PCI 32765, which later was approved as ibrutinib, and was game-changing in the treatment of CLL. And I got almost 7 years of good response to that. But I did relapse, and I was pretty much out of options. But my physician suggested I consider CAR T therapy, so I jumped into an early trial of CAR T therapy. In fact, all trials with CAR T are pretty early now. And I had an extraordinarily difficult and bumpy journey with 2 hospitalizations, extremely sick. But I'm happy to say that my restaging 1 month later showed that there was no detectable CLL in my blood or bone marrow. UMRD down to 1 in 100,000 using next-gen sequencing. And 1 year later, I have persistent CAR Ts in the peripheral blood, and I remain UMRD. So it worked like a champ, but it was very tough to go through. How does CAR T fit into the present paradigm for treating patients? So CAR T in CLL is still a completely experimental therapy. And because there is significant toxicity, usually manageable, but still the patient has to go through it, it's really not ready for frontline treatment. In fact, that's not the way it's being looked at right now. But I think CAR T is an important option for people who failed some of the, certainly people who failed chemoimmunotherapy and people who failed novel treatments or combinations of novel treatments. I think CAR T should be a real option for them to try, because cellular therapies like allogeneic hematopoietic stem cell transplants are the only proven potential cure for CLL.